I'd like to call the House Health Committee to order. Will the clerk please call the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Smith, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? Okay, seeing none, we have 6 items on the calendar today, and then following that, we will have a budget presentation from TennCare. And then I would just ask that the members, when we start talking to TennCare, to keep their questions and comments related to the budget. So with that, without objection, we will go into our calendar. Item number 1, House Bill 2348. Chairman Howe, you have a motion. A second, you're recognized.
Thank you, Mr. Chairman. Thank you, committee. This bill, Mr. Chairman, seeks to clarify law regarding mental health transports. If you recall, a couple of years ago, we passed legislation to relieve our county sheriffs of the obligation of having to transport mental health, mental health patients. And basically what we did, unfortunately, was treated our mental health patients like criminals. They were in order to transport them because they had to be taken by law enforcement in a police cruiser, and they were handcuffed, put in the back seat, locked in. As you know, the problem of transporting the mental health patients has been an issue. For example, in my district alone, in Bradley County, the Bradley County Sheriff's Office, before this grant program was passed, was forced to spend about $180,000 a year in overtime and lodging anytime they received a call from the local ER hospital that they had a mental health patient that needed to be transported to Memphis, for example, or Moccasin Bend. They had to dedicate 2 officers and 2 days round trip at taxpayer expense by 2 deputies who are not trained medical professionals. So we, thanks to the late Chairman Mike Carter, who helped establish a state grant program to allow these sheriffs to use grant funds to establish either an in-house transport program or to partner and contract with a secondary medical transport service. And that's what my sheriff did. Several other sheriffs around the state did the same thing. Bradley County contracted with a 16-year-old company who agreed to do just the medical transports. This is not an EMS service that they're providing. It's medical transport of mental health patients at no cost to the taxpayer because the medical transports are a billable expense to that patient's insurance, and that's what they do. What this bill seeks to do is to clarify and make it explicitly clear that based on current law, additional licenses are not required despite a recent EMS board opinion and a cease and desist letter to the contrary that required that transport services to have a license and a physical presence in every county from which they transported a mental health patient. They would just go pick them up, take them to the mental health hospital, and go back to their home base. So this bill makes it explicitly clear that if a medical transport company holds a valid license in one or more counties in Tennessee, they are not required to hold a separate license or establish a base of operations in every county where they provide mental health transport. With that, Mr. Chairman, I'd be glad to take questions if they have any.
Do any of the members have any questions? Okay, seeing none, we will vote on House Bill 2348. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman, committee.
You're welcome. That brings us to item number 2, House Bill 2005. Chairman Crawford, you're recognized. You have motion second.
Thank you, Mr. Chairman. Thank you, committee. Today I'm before you with House Bill 2005. This bill comes to me from a constituent back in Bristol, Tennessee, who owns a salon there that does massage therapy. She hired a young lady, not a young lady, but she hired a lady out of California to come to work for her. And when she got here, she was very distraught to find out that her license was no good in the state of Tennessee. This is a lady who's been licensed for about 30 years in California practicing. And so it's a problem that we're having through the whole state. And so it just kind of shined a light on our reciprocal agreements with the massage therapy license. So what my bill does is it basically allows for a temporary license for 6 months. It allows whoever, if they are a licensed massage therapist in another state and in good standing, then that gives them 6 weeks to get the temporary license that they need to go through the 2 tests that Tennessee requires. They've got 2 different tests that they require to be a licensed massage therapist. And it takes about 6 months or so to get all that done. So if you're a massage therapist and your license is in good standing, you move to Tennessee, you can keep working and putting food on the table for your family. So that's what my bill does. And I would like for you guys to support it. And I'll be standing here for questions, sir.
All right. Do we have any questions from the members, the sponsor? Okay. Seeing none, we are voting on House Bill 2005. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Chairman and Committee.
All right. Thank you. That brings us to item number 3, House Bill 2054. Representative Campbell, you're recognized. You have motion second.
Thank you, Mr. Chairman and members. First, let me say it's a privilege to stand before the best committee with the best chairman in the history of the Tennessee General Assembly, including my seatmate, as well as the gentleman that I've known the longest of anyone in this room. House Bill 2054. Currently, state law states that only a funeral director or an individual acting as a funeral director may start the death certificate. And frequently, hospitals and medical examiners start the death certificate process. Under this bill, it will ensure that hospitals, medical examiners, and funeral directors are all a part of the death certificate process. This bill is being brought to you by the Tennessee Funeral Directors Association, working closely with the Tennessee Department of Health and the Office of Vital Records, the Tennessee Hospital Association, Tennessee Medical Association, Office of the State Medical Examiner, and members of the Medical Examiner Advisory Council have been made aware of the bill in an effort to clear up any concern. Thank you.
Okay. We have an amendment, Amendment 013623. Is that correct?
013623 is correct.
Okay. You have a motion, a second on the amendment. Do we have any questions on the amendment? Okay. Seeing none, let's vote on the amendment. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, we are back on the bill as amended. Any questions of the committee for the sponsor? Seeing none, we are voting on House Bill 2054. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you.
All right, that brings us to item number 4, House Bill 2131. Speaker Marsh, you recognize. You have
Thank you,
motion
Mr.
second.
Chairman. This bill deals with pharmacy technician, which means an individual who is specifically trained and designated to assist a pharmacist and may perform tasks delegated by the pharmacist. It permits a pharmacy tech to perform tasks delegated by the pharmacist, including drug, supplement, and device selection, storage, distribution, and administration, if the delegated tasks are consistent with the pharmacy tech's education, training, and experience. With that, I'll answer any questions.
All right, do we have any questions of the sponsor of the bill? Okay, seeing none, we are voting on House Bill 2131. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 5, House Joint Resolution 733. Chairman Whitson, you're recognized. Your motion second.
Thank you, Mr. Chairman, and I just want to say Representative Campbell stole my introduction. House Joint Resolution 0733 is a pledge by members of the General Assembly to end the use of derogatory language in conversation or code directed toward or about citizens and constituents with intellectual or developmental disabilities. It's so easy to use the words that have become part of the vernacular in our everyday lives that individuals with intellectual disabilities and their parents and families very often hear others using this language is disrespectful and honestly extremely hurtful, even when done unintentionally. As legislators and representatives of those we serve, it is utmost importance that we neither intentionally or unintentionally use the type language that would hurt our constituents. The federal government years ago removed the words mental retardation and mentally retarded from federal laws. However, these words and forms of these words continue to be used. Often we hear people in positions of trust and responsibility say things like, he is a retard. That's a retarded thing to say. He's so stupid that he has an extra chromosome, or even, oh, I have to be retarded not to understand that. Folks, we need to end this. These type words, even when not directly stated about people with intellectual disabilities, have a devastating effect as they further negative stereotypes, hurt and isolate those with disabilities and those who love them, and ultimately work against our inclusion of our most at-risk citizens and their families. This resolution shows these valuable citizens, they are important to us, and we respect them as individuals. With that, Mr. Chairman, I renew my motion.
All right, thank you. Do we have any questions or comments from the committee? Okay, seeing none, thank you for bringing this. I think this does send a good message that we do need to send. So without objection, we will be voting on House Joint Resolution 733. All those in favor say aye. Opposed? Ayes have it. Goes on to calendar and rules.
Thank you, Mr. Chairman, and the Down Syndrome Association of Middle Tennessee thanks the committee.
Thank you. Okay, that brings us to item number 6, House Bill 2561, and I am carrying that bill, so I will pass the gavel to Chairman. Thank you.
All right, I think we had a motion and a second on the bill, and I believe there's an amendment.
Yes,
Here.
Amendment 13694.
And that's what I've got. Is that correct? Okay.
Need a motion.
Let's go ahead and get a motion second on the amendment. Got motion second on the amendment. Chairman Terry, you're recognized.
All right, thank you. This bill would enter Tennessee into 2 interstate compacts. Section 1 of the bill is for occupational therapists, and Part 2 is for audiologists and speech language pathologists. The compacts would allow reciprocity between these professions and other compact states. This amendment that we are hopefully going to put on clarifies that in Section 2, there is no change in the scope of practice for audiologists and speech language pathologists, and it also corrects a typographical error.
Have any questions on the amendment? All right, without objection, we'll go ahead and vote on the amendment, putting that on the bill. All those in favor say aye.
Aye.
Opposed? Okay, we're on the bill as amended. Any further discussion? Any questions on the bill as amended? All right, well, without objection, we'll go ahead and vote on the bill as amended. All those in favor say aye. All those opposed? Ayes have it. Bill moves on to government operations. Thank you.
Thank you, committee. All right, with that, we do have a presentation. We'll go out of session. For that, we have TennCare. We have our team here with us. When we do go out of session, we start taking questions. Again, I want to remind the members this is a budget presentation, and let's keep our questions and comments to the budget. So with that, we will go out of session.
Thank you very much, Mr. Chairman and members. It's a privilege to be with you today. My name is Stephen Smith. I serve as the TennCare Director. With me to my left is Zane Seals, our Chief Financial Officer. To my right is Dr. Victor Wu, our Chief Medical Officer, and Patty Killingsworth, our Chief of Long-Term Services and Supports. I know we are pressed for time, so I'll jump right in. Before we do have a slide presentation. We'll try to pull that up. I think we also have paper copies that we're handing out. Before we get into the specific line items, I do think it's important to at least briefly discuss how we got here, how we managed to be at a place where we can bring the types of improvements that we are bringing forward today, because it's an important story, it's a cautionary story, and it's also a guide for our future success. I always try to center our internal and external conversations on our mission, and that is to improve lives through high quality, cost effective care. Because as a Medicaid program and as a state, we have to be successful with both things. And sometimes, unfortunately, in the Medicaid world, there's this accepted narrative that that cost effective piece must, by definition, come at the expense of quality or access. And that's actually not the case. We've proven as a state that we can be successful at both. And I would argue the two actually go hand in hand. Controlling cost growth through appropriate measures means that we can provide more services, we can serve more people, and we can do it without breaking the state budget. And that budget piece is a very real concern. We've come a long way in our Medicaid program, but as we've talked about with this committee before, it really wasn't that long ago that double-digit growth trends threaten the very existence of TennCare. And I bring that up because sometimes people will say to me that if TennCare really believed in its mission, then you would cover more people and you would pay for more things and you would pay providers more for providing those things. And the reality is, of course, it's not that simple. And one of the reasons why it's not that simple is because of the impact that the TennCare budget has on the overall state budget. As you all know, TennCare represents a third of the state's budget. So what that means then is if we are unable to control costs to a reasonable level, there won't be any funds left over for all of the other state priorities. And the record K through 12 education improvement that's in this budget is a perfect example. And there certainly won't be any funding left over for the types of TennCare improvements that we've seen in recent years and the kinds of investments that we are asking you to fund for next year. And so with that, I'll jump into the specific budget requests. When we think about our major investments that we're proposing here, we group them into three buckets: people, benefits, and providers. And I'll start with people. This budget will increase the number of people that we are serving in TennCare. It will do it in a targeted and responsible manner. It recommends nearly $100 million combined state and federal funding on a recurring basis to serve more than 2,000 additional people in our Employment and Community First Choices program. That will reduce the waiting list by more than half. As you all know, this is a program that serves individuals with intellectual and developmental disabilities. It helps them to gain independence through resources such as employment supports, independent living supports, and peer and community engagement. In addition, this budget will allow us to serve an additional 1,750 individuals in our Choices program. That is a program designed for seniors and adults with physical disabilities. This increase will focus specifically on providing services in the home for those that are at risk of institutional care and allow the enrollees to live as independently as possible. This second piece is part of our Medicaid Alternative Pathways, or MAPS program, which is something the governor highlighted in his State of the State address. It's something that we are really excited about. I said earlier that we are targeting our increases in a responsible manner, one that recognizes the importance of sound, responsible, and conservative budgeting. And the MAPS program and this item are perfect examples of that strategy. Nationally and here in Tennessee, there is a lot of discussion about adding more people to Medicaid, but we should also be talking about the things that we can do to prevent people from needing Medicaid in the first place or from needing a higher cost Medicaid service. So that includes all the things that the state is doing in terms of education and jobs and economic development, but it also includes the kinds of investments that we are proposing through the MAPS program. Next, I'll shift to benefits. This budget will provide greater benefits and services to TennCare members. Most notably, we are proposing a historic investment that will provide dental benefits to all adults on TennCare. That's more than 600,000 adults who will now be eligible for dental benefits. There is strong evidence that dental services lead to improved oral health, of course, but also improved behavioral and mental health and increased employment opportunities. In addition, this benefit will reduce the high cost trips to the emergency department to treat oral emergencies. In the most recent completed year where we have data, we spent more than $10 million on emergency department services related to dental and oral health issues. So we would expect that those costs will go down if this item is approved. And then I want to be certain to highlight our Health Starts initiative, which is a $25 million investment to address non-medical risk factors that have an outsized impact on driving poor health outcomes. It's a series of evidence-based initiatives that provide clinical supports, resources, and technology enhancements. And this is a subject that's really important in Medicaid and the healthcare space because studies show that up to 40 to 60% of an individual's health is related to these factors, meaning that if we can be a bridge to addressing these issues, we can improve health and greatly reduce the cost of healthcare. And then next, I'll pivot to providers. This budget increases payments to our providers in a big way. I can't say enough about our providers, our TennCare providers. They have been under intense stress and strain, and yet they've remained committed to the people that we serve in TennCare and the state of Tennessee. And when we talk about quality and access, it's our providers that deserve the credit. Recognizing the workforce challenges that many of our providers are facing, as well as the previously mentioned investments to serve more people and enhance services, this budget includes nearly $100 million to support wage increases for our frontline direct service professionals that are working in our home and community-based service programs. And then there's an additional pool of $25 million that will improve payments to behavioral health and dental providers. As I wrap my prepared comments, Mr. Chairman, I do think it's important to circle back to a major policy initiative that this General Assembly approved in January of last year, and that is our TennCare 3 waiver. Contrary to what some believe, we've actually been operating under this waiver now for more than a year. In fact, we just completed our first year of the waiver, and it's a 10-year waiver. And as a reminder, under this waiver, Tennessee has the unique opportunity to be rewarded for its efficiency and sound management of our Medicaid program, and that comes in the form of additional federal dollars that we refer to as shared savings. And then we will reinvest those savings back into our TennCare program and the benefits and the services that we provide to our TennCare members. So the very kinds of things that we just talked about, this is how we are able to accomplish that. And as we have said all along, TennCare 3 is about more. It's not about less. I'm more convinced than ever that this waiver is good for Tennessee. It's good for the people that we serve. At the end of the day, it's about improving health, which drives down healthcare costs, which results in shared savings, which results in a reinvestment of those savings back into the program, which improves health. And then the cycle starts all over again. That completes my prepared remarks, Mr. Chairman. Again, it's a privilege to be with you all and happy to answer questions or hear comments from you.
All right, thank you for joining us. I appreciate the information, and I'll have some questions, but I'll have the committee begin. Chairman Whitson, recognize.
Thank you, Mr. Chairman, and Director Smith, and thank you and your team. I just want to compliment you on making sure there's not a waiting list for the Katie Beckett program, Part A and B. Mrs. Killingsworth, thank you so much for making that happen. And I had a lady stop me at a restaurant and talked about how this program has changed their lives. And I appreciate the skill and the determination that y'all do in administering this program. It's greatly appreciated. It's making a difference in people's lives. I just want to tell you that. And real quick, I saw something about the Alzheimer's drug that you list. Can you just briefly tell me the benefits or how that works? Because there's a lot of interest in that we deal with the Alzheimer's Association of Tennessee and the Tennessee Alzheimer's Tennessee.
This is a interesting issue. It's a complex issue. There actually was a lot of controversy around the FDA's approval of this drug. Ultimately, the FDA did approve the drug, and so once the FDA approves a drug, currently Medicaid programs have to cover it. So we will be covering the drug. Interestingly, Medicare has determined that it is only going to cover the drug for individuals that participate in clinical trials. So what that means, and it's a point of frustration for Medicaid programs across the country, is that for anyone that does not participate in the clinical trials and is prescribed the drug, Medicaid will have to cover it 100%, which means the states are on the hook for a significant portion of that. There's a lot of unknowns about this. We don't know how many individuals outside of the clinical trials, or even in the clinical trials, we don't know how many will participate, and then we don't know how many will seek the drug outside of the clinical trials, and we don't know how many providers, if any, will prescribe the drug to individuals that have not participated in the clinical trials. We have had no claims to date, but there's a lot that remains unknown. We're actually awaiting additional CMS guidance. I think we're supposed to get that in the next couple of weeks. That will tell us more. This projection is based on the number of individuals on TennCare that have an Alzheimer's diagnosis, and then we determined what utilization level we expected, and we applied the cost of the drug. The cost has come down some, but at the same time, the cost was decreased. That's when we found out that Medicare would only be covering for those that participate in the clinical trials. So we will probably have to come back to you at some point with adjusted figures, because these are our best estimates, but there's a lot of unknowns still.
You recognize?
Thank you, Director. Thank you, Chair.
Representative Byrd, you recognize?
Thank you, Mr. Chairman. My question is how you're going to be able to serve rural counties. I know I have constituents now that have children under TennCare. They have to drive, an hour away just to find dental care service for them.
Well, that shouldn't be the case. We believe we have an adequate network, certainly for children that are receiving dental services. If we have a case where a child is having to drive an hour, we want to know about that, because we would want to address it with our dental benefits manager. The adequacy of the network, of course, is going to be really important as we expand to adults, and that's something that we're going to work on. And really, this enhanced benefit is part of this package that's in the governor's budget. It's coupled with the Department of Health recommendation that really is tied to recruitment and retention of dental providers, dentists, and also we have the rate increase, and all of this kind of ties together to try to make sure that we do have an adequate network for TennCare that can serve both our children, but also serve the 600,000 adults. But I would be interested, maybe we can circle back and I can get that information from you.
Okay, thank you.
Speaker Marsh.
Thank you, Mr. Chairman. Thank you all for being here, and thank you for the good work that you do for Tennesseans. And I'm excited about the wage increases that we put in for the Choices program. And, we've had a workforce crisis, and this was very, very important and badly needed. Now that we have the funds available to help stabilize this workforce, I'm interested in the rollout. Has it all of it been put out to the providers, and are you getting feedback from them on how it's working? And what about the agency audits that come with that?
Mm-hmm. Thank you for the question. We actually have started this. We were able to start it with ARP dollars that were appropriated specifically for home and community-based service programs. So when you look at the line items for that workforce development that says $50 million, that's this first piece of this wage increase. And you'll see a zero by the state funding because we're able to use ARP dollars. And then once the ARP dollars expire, we will pick that up with the state portion. So the commitment is there. So this has actually already started. We are making sure that one of the conditions of this is that the dollars have to be given to the frontline direct service professionals. Some providers are not, they're not very happy with that, but we heard loud and clear from the General Assembly that you wanted those dollars to go to those workers, and we agree with that. That makes sense. When we hear from providers about the need for higher rates, typically the reason they give for that is because they say they need to pay their workers more, and we agree with that. So we think it's appropriate that we require those dollars to be passed on to those direct service providers. And I may turn this over to Patty to give a little bit more detail about the process, though.
Thank you so much for the question. In terms of implementation, we received expansion authority to receive and expend the federal funds, I think on November 2nd, and we began immediately thereafter then with the process. It does require an attestation from the provider that they will in fact pass those funds along to the frontline workforce. And then the rates were retroactive to July 1 of 2021. So for providers who've completed the attestation, the rates are in effect and the claims have been retroactively adjusted. That covers the first 50 million. Then the second, about 45 million would be an additional increase on top of that, which if approved would be implemented on July 1st of this coming year. And would take the amount that is accounted for in the rates up to $13.75 per hour as an average hourly wage for that frontline workforce.
And do you all audit to make sure that they're spending these funds correctly? You go back behind what they're doing and make sure it's right?
Yes, sir. We have established an audit process that we will be looking at every single provider as a part of the credentialing process to ensure that that occurred.
Thank you. Representative King, you're recognized.
Thank you, Mr. Chairman. Thank you, Director and your staff. Two quick questions. One, under choices, I believe what I want to find out is dealing with the $1,500 per year. Is this for persons who Alzheimer's, dementia, being home as opposed to being in a institution?
Yeah. What'd you take?
So the Choices Program, yes, you're exactly right, serves older adults and adults with physical disabilities. The Choices Program actually does include a population of people who choose to receive services in a nursing home, but there's a large number of people who choose to receive their services at home. The Choices Group 3 item is for one of those populations of people who don't actually qualify for care in a nursing home, but it does help to delay their need for a higher level of care by making those services available to them.
All right, thank you.
You're recognized.
And secondly, you were speaking earlier, I believe, about Alzheimer's drug and so forth. Am I correct that entities like Johns Hopkins and others have great pause or concern in regards to that particular drug?
There was a lot of concern raised by several individuals when that was going through the FDA approval process. And in fact, there was a committee that makes a recommendation to the FDA, and the committee recommended against approval, and then the FDA approved it even with that recommendation. So there was a lot of controversy about it.
All right. Thank you very much. Thank you, Mr. Chairman.
Thank you. Chairman Ramsey, you're recognized.
Thank you, Mr. Chairman, and Director Smith. Appreciate your presentation. Appreciate the great service you and your staff. We love dealing with your liaisons. They're very open and helpful. You warmed my heart by taking care of adult dental care, and that's something we've been trying to affect for the last 10 years. And I would ask, is the benefit manager going to be the same as for children's dental care? Is it going to be the same kind of contract?
Well, we don't know. Ultimately, the General Assembly will have a say in that. I can tell you that if the fastest way to implement this would be to amend the existing contract, and of course, we'll have to come to fiscal review for approval of that. That's the fastest way to get it implemented. Otherwise, we would have to do a new procurement, and that'll put it off, several months.
I once again appreciate where you're going with this. We've had great relationship with DentaQuest and look forward to dealing with them again. And they've kind of become the go-to with issues from providers and have done a good job of it in communication. I'll be open for information and help you in any way that I can. Appreciate you very much.
Thank you.
Thank you. Chairman Jernigan, you're recognized.
Thank you. I want to touch with what Chairman Whitson was talking about, the Katie Beckett program. Very proud of it. I noticed though the projection, I guess, of enrollment for numbers were high compared to what the enrollment is. Are we satisfied with that number, or is the agency going to look forward to promoting the program, awareness, that kind of thing?
Thanks for the question. So when this was going through the legislative approval process a couple of years ago, we actually didn't know what the demand was going to be. And so we worked with the Tennessee Disability Coalition to try to come up with what we thought was the best projection with the information that we had at the time. But we said all along, we didn't know what the demand was going to be. To date, we have had 2,100 applications for the program. If you look at our enrollment, we have about 1,600 that are enrolled, and that is either enrolled or they are awaiting eligibility determination. So I don't look at the fact that we've received about 2,100 applications. I don't look at that as a negative because we really didn't know what the demand was going to be. I think we've done a lot of outreach, and I think that overall there's been people are pleased with the process, and I know that people that are in the program are very pleased with the process. We continue to have conversations and communication with the technical advisory group that was established specifically for the Katie Beckett program. That's made up of advocates and parents and individuals from TennCare and also our sister agency DIDD. There are choices that we could make. We could lower the level of care eligibility that would allow more people to be eligible for the program. But if we do that, then we run the risk of individuals that have more complex needs presenting later and there not being a spot. And so we want to be very careful with that. If we look at our current enrollment, our monthly enrollment, then we believe that all the Part A slots will be filled by the end of this calendar year, December of 2022. Part B, it will be into 2023 at the current rate, but we will eventually get there. But we could make the choice to get there faster by lowering the eligibility standards, but we just don't think that's the right way to go because we want to make sure that we can serve those with the most complex needs as they present themselves for enrollment into the program.
Yeah, I wasn't stating as a negative. I was asking if we were satisfied with that, which sounds like that we are.
Yeah.
And do we budget? Did we budget for the high number? And so that money that's there,
We did. So
we're just sitting on it, or
well, it's in our the dollars that were appropriated that we didn't expend would be going back to our reserve. We haven't spent the total amount that was appropriated because we haven't hit those original projections. But we will eventually get there. We think it's just gonna take some time.
so the money goes back to the reserves though, but it is earmarked for that program.
Katie Beckett earmarked. Yeah, it's in our reserve, and then every year, of course, we're getting another appropriation for the full
Oh, you
amount.
tap it. Okay.
Yeah.
All right. Thank you, Chairman.
Representative Clemens, you recognize?
Thank you, Mr. Chairman. And I just wanted to follow up on that real quick. This is what I wasn't going to ask about this, but I didn't hear the answer. Did you say that there was money allocated to market the Katie Beckett program to get more enrollees, or no?
No, I believe there's not money specifically allocated for marketing, but we do our own communication internally, and then we work with our advocacy partners and also our managed care organizations to get information out there about the program. And we also work with our sister agency, DIDD, on this.
Okay, thank you. And so what I was really going to focus on was the dental benefits for adults. That's incredibly important, obviously, and I don't know that we talk enough about the importance of dental health and the impact that has on overall health. And I saw in here for page 4, I guess, on the slide, it says more than 600,000 adult TennCare members served with a comprehensive dental health benefit for the first time in program history. Is that in the past year, or is that moving forward? And what led to that? Made that possible?
I may need some clarification on the question. You mean, how did we get to the 600,000
No,
number?
I'm just the way it's written in here. I don't know if you're bragging that happened last year or if that is going to be possible because of the budget.
Oh, gotcha. It'll be possible because of the budget.
Okay, and so what's the price tag on serving 600,000 with comprehensive dental benefits? You had put in here 25 million for payments, but that included behavioral health as well. So I was.
Oh, the 25 is only for the behavioral health and the dental. Behavioral health and I'm sorry. Yes, the 25. If you break it down, the 25 speaks to the provider rate increase,
Right.
And that is about 11 million on the dental provider rate increase of the 25.
Okay.
But to cover the benefit, it's the 75 million number that you see there. So 75.5 and 25 of that is state, and 49 is federal.
And what is the increase of that over previous years? How much of an increase is that?
Well, that would be 100% on the adult dental benefit number 1. That'd be a 100% increase because we don't cover that except for a very small, limited adult population. Those that some adults that have disabilities.
Yeah. So then, so what made this possible? Why are we all of a sudden now able to do that?
Well, I think we're just in a position now where we have the revenue available to make these kinds of investments. And I don't want to speak for Commissioner Ely or the governor, but we put forward this item. We think it's something that will, when we talk about our mission, improving lives, we think that this will do it. And so we're thrilled that it was accepted and it's funded.
Yeah. Thank you, Mr. Chairman. Well, that's my point. I fully support it, and I'm glad we're doing it. I guess I was just kind of trying to figure out why we weren't doing it before. I think we have revenues before, and you don't need to answer that question, but I'm excited we're doing that moving forward. I think it's a huge opportunity, and I'm glad we're providing that because, like I said, I don't think we talk about the impact of dental health enough. And if we can provide 600,000 adults with dental coverage, that is truly significant. So thank you for that. And all I got, Mr. Chairman. Thank you.
Thank you. And to follow up on that, I actually had notes similar to what you were asking, but one of the things that you did bring up was potential cost savings of going to the ER. And I've had to deal with patients that have had oral abscesses and stuff like that and had airway issues because they end up didn't have dental care and went to the ER and ended up with those type of issues. But you don't have to do it now. But at some point in time, if the cost savings of those type of treatments to offset some of this, if you can just get those numbers to me, that'd be great.
Yeah.
Representative Alexander, you're recognized.
Concerning the Choices program, is that an open enrollment now? It says in your notes here, 2,300 additional individuals with intellectual and developmental disabilities served, reduces waiting list by more than half.
Yes.
So does that mean you have 4,600 on the wait list for Choices?
We have almost 4,000 that are on the wait list for the ECF Choices program.
Okay. Wow.
Yeah.
I have a friend who has a child that's been waiting for 2 years. He's a physician in Johnson City. He's a pediatric surgeon. And these children weren't wanted by their parents when they were born because they had deformities. And so he brought them home. 3 of the children have had the Choices program. 2 of the children have had the Choices program. 1 has not. And he watches every day his brother and sisters go to work. And it's just a glitch in the system, in our system somewhere. And they can't get this 3rd child on for some reason. And it's been going on now for about 1.5 years. So.
Well,
it's just-
our goal would be to have no one on the waiting list, and we're really excited that we have the opportunity here to cut that wait list in half.
Thank you. Thank you. Thank you.
Okay, any further questions from the committee? Okay, seeing none, thank you for your presentation. Looks like there's some exciting things going on with this. I'm going to circle up with your staff here. I've got a few questions I need to ask, but again, appreciate you guys coming, and thank you for your presentation.
Thank you, Mr. Chairman, members.
All right, without objection, we'll go back into session. Any further business from the committee? Okay, seeing none, we are adjourned.